record. We're good. It is now week 7. Let's go into week 7. And it is musculoskeletal systems. Now, the musculoskeletal system, this chapter is pretty neat because this will help you dramatically with memorizing all the bones and the muscles when you're in, good evening, Miss Michette, and when you're in anatomy and physiology, because anatomy and physiology, all the names of the bones and whatnots, that's not English. It is what? Latin with a touch of Greek, which is medical terminology. So I'm going to show you some things there. And of course, I'm going to put in the discussion forum later. And if I forget to, it's essentially watch, rinse, and repeat. Make sure to create a quiz for the musculoskeletal system with the, with the cases that are in the end. And let's see if Medical Language Lab is being nice to me. Kindly mute when you get on, please. And I'll be trying to watch the chat for periodically for any questions. So, okay, I got one person, and I'm gonna send that later. Let me write that down so I know. Okay, but again, everyone else, kindly, what do you call that? Kindly shoot me an email with a request so I can track it. All righty. So let's look at the chapters, and I'm going to go to musculoskeletal, and then we're going to go to chapter 10. And of course, we start off with who are the people in our neighborhood. So orthopedics, rheumatology, my favorite, and chiropractic medicine. Now, if we look at the word orthopedics, let's look at that, ortho. Ortho means to straight out. We already learned that for orthodontics. But peds is to walk, right? If you're pedals, you put your feet on it and you walk. So ick pertaining to orth, straighten, peds. And they are a surgical service, meaning they solve a lot of their problems with surgery. And think about it for any of you who've ever broken a bone. How's your movements? How's your posture? Even if you broke your hand, you're not walking up straight. It's very, very painful. Now that deals with the bones and muscles. Now rheumatology, rheumat means they deal with the fluid that's in your joint spaces, and they are experts at the arthritides or arthritis. There's quite a varied set of form of arthritis. You have rheumatoid, oid. It looks like rheumat, looks like the fluid in the joint space, but it isn't. And since it isn't, it causes an itis, inflammation, or infection. Osteoarthritis, you get OA, especially when you get older. And we're going to talk more about that in anatomy and physiology. You also, and rheumatoid arthritis, since it's an itis, it's also considered kind of like an, what do you call that? It is where your immune system actually attacks yourself. It is considered an autoimmune rheumatoid arthritis. And that's why they look for antibodies, for rheumatoid antibodies when you get diagnosed with rheumatoid arthritis. And arthritis, for any of you who have it, it is not fun. And the rheumatologist is the person who deals with all of the joint spaces and what they call the arthritides. Now, chiropractic medicine, rheumatology, and orthopedics, those are subspecialties. Orthopedics is a subspecialty of surgery. Rheumatology is a subspecialty. Rheumatology and hematology are subspecialties of internal medicine. But chiropractic medicine, they're also called doctors. They have a PhD, but their basis is on musculoskeletal disorders that require treatment via what they call the modalities. And then the modalities are like like heat and stretching and massage. And if you've never been to a chiropractor, a good one, please go. I have a good friend, John. Um, I find it very interesting that all of our friends call John Dr. John and don't call me doctor, but that's just me and my ego. But they're also a doctor and they do things, and they can't order the radiograph study like an X-ray or a CT, but they can look at it. I have to order these, but my friend Dr. John, who's a chiropractor, and he probably does manipulations on my back and on my really bad joints about twice a year, and it just at first it kind of feels weird because your body's making sounds that you've never heard before, and it's sometimes it's a little bit uncomfortable because they're stretching. But when you look at the musculoskeletal system, right, the muscles and the skeletal system, again, even though we discuss them separately, they work together. And stretching and heat, ultrasound, and all of these things, and also the spine manipulations improve a lot of things. And there's a lot of data about chiropractic medicine and its role, and it's really great in rehab. Now let's look at some of my claims earlier, and this is going to be a little bit primer of how to name names in anatomy and physiology. So the first thing that you can also look at is there are certain muscles that have a certain shape. So if we look at this one muscle right here, it looks like a triangle. And in Latin, triangle is delta, but it's not really a triangle, right? It kind of looks like a triangle, and oid is the suffix that means resembling, so that's got to be your deltoid. Another another muscle back here that looks like a, let's look at this. It looks like a trapezoid. That's why they call it the trapezius. So if I look, see, that's a trapezoid shape. Then I look at this. Can you see how it looks like that? It kind of looks like this. And if you know what a trapezoid is, remember in high school when you said you'll never ever use geometry? Well, here you go. You're using it right now. That's a trapezoid. You also have your rhomboid muscles. So what is a rhombus shape like? Rhombus kind of looks like that. Kind of like a squished rectangle. Well, your rhomboids have to be in the back, and they're underneath here, right? They can't show it, but it looks like what? A squished rectangle. Another thing that we also can tell from muscles and the names of muscles is there's some muscles that have two of them. So you have here in your lower leg, biceps. Sep means head, right? Just like the word cephalic. Bi means two. So this muscle back here has to have two. And your biceps brachii, they have to have two muscles. Your triceps brachii, they have to have three muscles. And right here on your thigh, your quadriceps, that has to be four muscles. And you can see also here, the name also gives away the location. Femoris, so that's got to be in your thigh, femur. So your quadriceps femoris, that's got to be here. Pectoralis means chest, your pecs, right? Brachii means your upper arm. So the biceps brachii and the triceps brachii, that has to mean it's the muscles of the upper arm. Another thing regarding location, look, abdominis, that means it's got to be in the abdominal area. Also pertaining to shape or direction, rectus means straight. So you have rectus muscles going up and down right here, okay? And you also have a rectus muscle, your rectus femoris. It's got to be one of these straight muscles here that's going straight. Oh, looky here, you have your brachioradialis. It's got to be the muscle from your brachium, which is your upper arm, to your radius, which is one of your bones on the thumb side of your lower arm or forearm. And that's why when you feel this pulse right here on the thumb side, right, that is your brachial pulse. I'm sorry, your radial pulse. And your upper arm, your brachial pulse is here. So here's your radial or radius bone, radial pulse. Here's your brachium, and your brachial pulse has to be here. Regarding shapes, if you look at your face, an orb is something circular. So your orbicularis oculi has to be the circular muscles on your eyes. Your orbicularis oris has to be your circular-like muscles around your mouth. So you could see here, just by looking at this example, very basic example of classic muscles or the gross anatomy. And by gross anatomy, we mean anatomy that we could see and measure and weigh with our eyes. So you could see how your medical terminology powers can help you. So let's look at emoji reactions. Why do I need emoji reactions? Okay, let's look at some of these combining forms. And again, for your final exam, I believe one or two of you did the final that's online. That's not your real final. That's a nice practice one. But we have a case study final, which will encompass the majority of the cases that either we've gone through or we've gone through certain chapters. And those are, that's the one that, let me just answer this. Okay. That's the one that we're really looking at. We're really looking at cases and how to read cases. And that's why you're going to spend these next couple of weeks practicing on how to look at cases and how to preempt me by looking at what's important and making your own quizzes. So let's look at the words and some potential words that can be discussed in cases. Or as a side question. Now, you know when you're eating chicken and they have that extra skin right underneath the skin that connects into the tendons, that connects into, that rubbery part that connects into the bone? That's your fascia. It's a fibrous membrane and it's covering the muscles. So, when you tear muscles or you tear bone, you're also going to tear your fascia. So you need the orthopedist to perform a fascioplasty. Plasty, of course, the process of repair, surgical repair, and fascia is the fibrous band covering your muscles. Fibroma, is just a tumor. It's a lump or a bump. So we don't know if the fibroma is malignant or benign yet, but typically they're benign. But we can get a weird one every once in a while. Now, muscles. Let's look at muscles. And again, a little bit of a primer on anatomy and physiology. There's three types of muscles. There is skeletal, which is voluntary. That means you have some control. There is cardiac, which is voluntary, that you can control. And there's also visceral. And we know visceral, pertaining to our guts. What does that mean? Huh? Wait a minute. I'm still on here. Okay. As long as I'm still on here and you're still on here, it's all good and we're still recording. So we're all good. Okay, guts. So visceral, pertaining to your viscera or your guts. And that, of course, is what? Involuntary. You can't control your guts. You know when your stomach makes those crazy sounds? Now, visceral muscle is also called smooth muscle because if you look at it on a microscope, it doesn't have these lines or striations. And these striations or stripes, right? That's why they call skeletal muscle striated muscle. And of course, cardiac is involuntary. You can't control your heart. If you're scared, your heart's going to go fast. No matter how much of a cool cucumber you are on the outside, your heart rate will go up. So skeletal muscle, it's called striated muscle because it has stripes on it. Striated muscle. Smooth muscle, also known as visceral, that's involuntary. That's the stuff that's lining your genitourinary tract and your gastrointestinal tract. And of course, cardiac means act pertaining to your heart. So, what happens if I did this? Oop. Wouldn't turn anything on. Nope. Okay, are we still here? Yes, I guess so. All right. So when you have a leiomyoma, that is a tumor of smooth muscle. It's not the tumor of either cardiac or visceral muscle. Cardiac muscle will be what? Cardioma, and striated muscle will be rhabdomyoma. Rhabdo, is it here? Oh, no, it isn't. Oopsies. They didn't put that on. So the example skeletal would be rhabdo. And you can get rhabdomyolysis. Woo, spreading COVID, one sneeze at a time. Right? Rhabdo is smooth muscle, and rhabdomyolysis, myo means muscle, lysis means breakdown. That's if you work out too hard. I just saw a thing on Channel 4 the other day where some crazy neurotic woman somewhere in Maryland, she works out like 6 or 7 hours a day, and she doesn't want to go on meds. And that's a little much. And little by little, she's in great shape, but little by little, her skeletal muscle is wearing away because it's working too hard. Remember, it's good to work out, but it's never good to work out too much, especially if you're coming back into getting in shape. I highly suggest just stretch and just do a little bit every day, like 20 minutes, and then little by little by little, and take days rest for soreness, because when you have soreness, that's actually some small form of rhabdomyolysis when you get sore. Now, muscular, lumbosacral here. I skipped one. Lumbo means your loins or your lower back, because where do you tie a loincloth? You tie it around your waist. So your lumbocostal area has to be the area between your waist and your cost, which is your ribs. Muscular, that's easy, pertaining to muscle. Myorexis, you could have a rupture of a muscle, either from overexertion, or maybe you had a fracture of a bone, or a really bad strain or sprain. Now, why do I say strain or sprain? Now, to the layperson, strain and sprain is the same thing. And also clinically, it's the same thing. But a strain deals with tendons. And tendon is the connective tissue that connects muscle to bone. And ligaments is a sprain, and that's what? Bone to bone. It's a minor point, but you guys are future clinicians and current clinicians. You should know the difference. Tendon, we just mentioned that. That is the fibrous connective tissue between muscle and bone. You know, that rubbery stuff that I was telling you about when you bite into a drumstick on a chicken, and the drumstick on the chicken, dissect it next time. You'll find that there's 4 parts, because that's the chicken's femur. That's your quadriceps. Quad means 4. So we could do a tendoplasty. That's a surgical repair of the tendon, right? For all you football fans. Tendinitis, inflammation or infection of the tendon. Okay. And some of you, if you've had one that was really bad, you can get casted up for such things. Algia, we already know, myalgia. That's pain where? In my muscle. Now, asthenia, myasthenia. Myasthenia is the weakness of muscle, and myasthenia gravis is a really, really bad disease where you have progressive muscle weakness, and it'll be something like, let me try to remember the case of my last myasthenia patient. My last myasthenia patient, he woke up like really sleepy, and around 9 o'clock, he was really tired. At around 9:30, 10 o'clock, he was like, oh, I'm gonna leave work. And then he tried to go downstairs. It took him 10, 15 minutes from a 2nd story walk up. And that's a long time to go only down 2 stairs, 2 sets of stairs. Then when he got out of the street to hail a cab, he couldn't raise his arms. And by the time he got into my ER around 12:30, he couldn't breathe. Because remember, our, um, our, our muscles of respiration are muscles. And if something happens to them, that's a very serious thing. Myopathy, pathy, disease of muscle, a cardiomyopathy, which is very common, a disease of your heart muscle. All right, next, hemiplegia. Let's look at that suffix for a minute. Plesia, paralysis. Okay, so what does that mean? So if I look at the word paralysis, it means paralysis. We already know lysis means breakdown. Para means alongside. So what does that really mean? Breakdown along the sides. Sides of what? Well, let's look at spinal cord, spinal nerves. This is your spinal cord. These things, this is your spinal cord, the thing in the middle. These yellow things, and it's yellow because anything colored yellow has fat, and your nerves are covered in adipose tissue and fat for insulation. And these things that are coming out of here are spinal nerves. C stands for cervical, which is your neck. T stands for thoracic, which is your thorax or rib cage. L, remember, lumbar, your loin. And S is your sacrum, which is the bone right before your coccyx, the set of 4 to 6 fused bones right down here near your coccyx, which is down here, which is your, you know, what laypersons call your tailbone. Now, remember, paralysis means, what does paralysis mean? Paralysis means breakdown, right, alongside. So when we break down alongside, what if I took a knife and I cut you all the way from here to here, all the way alongside your spinal cord? If these are all somatic nerves, meaning nerves that connect to your body, and you need your brain to send a signal to your nerves and then to tell your muscles what to do. What happens if I cut all of this? If I cut all of that, can you move? Of course not. Hence the term paralysis. Breakdown alongside your spinal cord, and that's paralysis. And that's no bueno, because if I cut any of these nerves, or if a nerve gets damaged, you cannot glue it back on. You can't just sew it back together again. You can't just plasti it back together again. That's why when you go blind permanently. If you lose your ability to walk because of significant spinal cord damage or severing of your spinal cord, you're really not going to walk ever again. But until Johnson & Johnson figures out this thing called brain glue and nerve glue, they've been trying to develop it since like 1989. My sister used to work for Johnson & Johnson. Maybe in the next 50 years, they'll figure it out. But that would be a really neat thing if we could do that, especially for people who have transections of spinal cord injuries. Hemiplegia. Hemi means half, so one half. So if I have hemiplegia, paralysis of only one side of my body, and you'll learn that in anatomy and physiology too. Why only one side? Why is it when I get a stroke, it's on one side or the other? Myography. Now, unlike nerves, you can sew muscles back together again and they work. And that's myography. And anyone who's in professional sports knows all about that. I'm not sure if I told you the story about my 4 nephews. Well, they're not my nephews, they're by marriage. My wife's nephews. They're all in NCAA Division I schools. They're barely in their 20s. All of them had all of the above surgeries that I just mentioned. Spinal cord injury, lumbosacral injury, knees, tendon, sprain, strain, you name it. Even myography, torn muscles that had to be sewn together. The youngest is 19 and the oldest is 22. And all of them have multiple surgeries, all in the quest to become a professional athlete. Myosarcoma. Now, remember I said OMA, right? OMA alone means tumor, lump or bump. But sarcoma together, that means it is a malignant tumor. A myosarcoma or any sarcoma is bad news. That means it's malignant, That means it'll grow very fast, it'll spread very fast, and will cause a lot of damage in a short period of time. Fast forward. Now let's look at the motions. These are really nice, especially those of you who want to get into physical therapy. Now, if you have one motion, you got to have the opposite motion. So flexion, if you look here, and remember I told you that, remember you told yourself in the beginning of this lecture, like, oh, I don't need geometry. Forget that. Well, guess what? We need it again. When you move your joints, there's something called ROM or ROM or range of motion. Flexion decreases the angle of the joint. So when you have your arm fully extended, that's a 180 degrees. If you have your arm straight up like this, that's 90 degrees. If you have your arm here, that's less than 90 degrees. So if you move your arm from straight out and all the way back in, that's called flexion or decrease of the angle joint. And the exact opposite is extension. And depending on what you can or can't do, or limited range of motion or limited angle, the orthopedist, the chiropractor, and the rheumatologist can diagnose you for certain things. Here's adduction or abduction. See, oh, this is going to mess you up on the exam. But if you look at your medical terminologies, so abduction, ab means what? Away. When you abduct somebody, you take them away. So my patient here is taking her leg and her arm away from midline, hence the term abduction. Now, adduction is the exact opposite. You're adding towards midline. Remember, when you have opposites such as these, you memorize one like your life depended on it, and the other one simply is what? The other one. What did I do? Why is it doing that? Oh, man. Why are you being like that? Okay. It redeemed itself. Okay. Let's now look at pronation and supination. Pronation turns your palms down. Supination turns your palms up. Again, memorize one like your life depended on it, and the other one is the other one. And the pronation supination test, that's when they, the police officer makes you do like patty cake and stuff like that. A lot of the neurologic tests are copied in sobriety tests that the police do to check to see if you're drunk. Eversion and inversion, all you ladies who love your 4-inch high heels, this may have happened to you. Eversion, it moves the sole outward, when you're wobbling on those stilts. And, most dance floors are not conducive for friction, so slip a little bit. I remember we warned, I just remember last pinning ceremony, we warned all the nurse graduates, please wear sensible footwear because you have to go up and down the stairs. I remember me and Mr. Briscoe from Falls Church were, we had the dubious distinction of catching people who almost fell down the stairs. And inversion is when your heel turns inward. Either way, you can get a sprain or strain or even fracture, right? So, just be careful out there when you're trying to look gorgeous. Now, dorsiflexion and plantar flexion. This is really important in the diagnosis of transection of the spine injuries in a test called Babinski, or your Babinski plantar test. Now, if the toes fan out when I tickle the bottom of your foot, that's no bueno. That means you have a transection of your spine. Typically what will happen, you'll see dorsiflexion. Now, this is how I remember things. Where do you plant? Because where do you plant plants? You plant them into the ground. So this is plantar flexion, and the other one is the exact opposite. You plant plants into the ground, so I'm pointing my toe into the ground. But if your toes fan out, if I tickle the bottom of your feet, ooh, don't make any plans, or make some plans to get some stock and some wheelchairs. Now, if you look at here, the bones, again, we won't be telling you to memorize your bones, but You're going to need this skill set. Might as well start looking at them now. You're going to need it for your anatomy and physiology. And let's see where we could use our medical terminology powers. So when we look at here, phalanges are your fingers and toes. The way you differentiate your fingers and toes is phalanges upper extremity is what? Your fingers. Phalanges lower extremity is your toes. Now, from thumb on down, that's how you label the your toes or your fingers. So it's like your thumb is number 1, your pointing finger is number 2, middle finger is number 3, ring finger is number 4, and your pinky is number 5. So if I have a fracture of my right thumb, that means I have a fracture of my right phalange 1 upper extremity. Now, carpals are your wrist. Metacarpals are the changing of the bones from a short bone to a longer bone. Meta means change towards your fingers. And since you have carpals, metacarpals, and phalanges, it mirrors it here. Your ankle is are tarsals. Then you have the dorsum of your foot, which is metatarsals. And then, of course, your toes, phalanges. Let's look. Carpal, we already told you, that's wrist. So if you have carpotosis, that's if you have carpal tunnel syndrome, you're going to have a downward displacement or drop of your wrist. Another time you're going to have carpotosis is what they call dinner fork deformity. When when you fall, you put your hands out and you try to break your fall. Well, you can break your wrist that way as well. Let me show you what I mean by dinner fork deformity. See, this is carpotosis. Gonna look your hands are gonna look like a dinner fork, like this, bent like that, because and your wrist will droop down, and this thing will be all super swollen because it's a fracture. It's not fun. And try running around with a fracture. Anyone ever try to run around with a fracture? Not fun. It's quite painful. You don't realize how much your body absorbs energy and shakes until you try to run with a wound or with something sensitive. Costal, we already went. So subcostal is beneath the ribs. The subcostal area of your ribs are very sensitive. So when you're doing EKG, should you be poking your patient very hard there? There's a artery, vein, and nerve down there in your subcostal region of your ribs. That's why it hurts. Cranial, cranium, structure of, crani, your skull. So a craniotomy is I'm doing an incision in your skull. It's not really an incision. It's more of like drilling holes in your head, because when we do a craniotomy, before we cut you totally open, I got to drill these pilot holes in your head. And especially we use craniotomies to relieve intracranial pressure if you have a bleed. Because remember, your brain is in there, and if it starts bleeding, it starts squeezing your brain, and then it squeezes this little place called your arbor vitae, and it tends to shut down your blood pressure and your, what do you call that? Your breathing. So that's why sometimes we got to open your skull up, and we try not to because your brain is sterile, and the second we start opening that to the free world, that's when it gets really, really bad. Your humerus or your funny bone, right? That's your upper arm, also known as your brachium. So your humeral bone is, of course, your humerus, upper arm. Metacarpals we already talked about, phalanges we talked about. We looked at our vertebrae, right? And one word is spondylitis. You can have inflammation or infection of those vertebrae. And remember, look at bone like a living thing. It can get infected just like anything else, because bone is hollow. Why am I just saying this to you? Let's show it. Hey, what's going on? All right. This one's good. It's good. So if you look at this, okay. Oh no, that's not good. Let's look at it this way. Well, this one, any one of these, your bone is not really solid. it's hollow, and it's got all these scaffolding and all these structures. And if you look inside, there's a vein, artery, and nerve all along running through these Haversian canals. And what gives your bone strength is because you have all these osteons, or these little concentric circles called lamellae, or these lamellations, right? Like lamina, if you've ever heard of a laminated floor. It's a floor made up of little sections all glued together. That's what gives it its strength. And think about it this way, like an analogy. You can easily snap one twig, but what happens if I bind all the twigs together? It's really hard to break, and it's light, and there's nutrients inside here constantly working on the bone and remodeling it. That's what gives the bone strength. And you can also see that's what also gives the bone disease. That's what also gives the bone inflammation or infection. And it's really neat that there's arteries and veins in there and lymph nodes in there. But the problem is something like Ewing sarcoma could easily go in and out of your bones and into your blood system, which is not good. Your sternum, that's your breastbone. Sternocostal, that's pertaining to your sternum and your ribs. That's easy. Your calcaneum, which is structure of calcaneae, which is your heel bone, and you could have calcaneodynia, common in runners who don't wear socks, and it's those of you who do run have at least two pairs of shoes. I learned years ago that every shoe has its own special set of pressure points, and if you have the same repetitive pressure on the same area, it's going to cause damage. Femoral, pertaining to your femur, which is your thigh bone, the largest bone in your body. Tib-fib, tibular or fibular. Tibial and fibular. It's easy to remember the tib-fib. That's in the lower leg, right? And the tibia is the one in the front, and the fibula is the one in the back. And you might even hear this slang, tib-fib fracture. That's when someone fractured their lower leg. And because if you typically fracture your tibia, you're most likely going to fracture the posterior part of your fibula as well. Patholectomy, we remove kneecaps, right? Pelvimetry, that's when we measure the pelvis. Typically, pelvimetry is used in obstetrics, and we do it via ultrasound. Radiation, of course, radiograph, that's another fancy way of saying X-ray. Ankylosis, osis, abnormal condition of something that's being stiff or bent or crooked, okay? Usually regarding a joint space and or your spine. Arthritis, we already went over. Cartilage, right? Costo, right? Also means ribs, because your ribs have a lot of cartilage. So condor is the cartilage. Costo is the ribs. Sorry, had to make that distinction. So if you have costochondritis, it's your ribs, but what specifically about your ribs? The cartilage section of your ribs that's inflamed. And again, cartilage is just like bone. It's got all these spaces. Things can go in and out of cartilage that can infect it, but it has nowhere near the capability of inspiring infection like bone would and other tissue. Laminectomy, we already talked about that, your lamina. But, this is a little other part. Let's look at your vertebral arch and look at what they mean by what's lamina and what is a laminectomy. So when I look at this, why so little? Okay. See these little arches, like this is called a pedicle, but there's these arches here. Remember those spinal nerves that we talked about? They pass through and pass, this is your spinal cord will be here in your vertebral foramen, right? Foramen means hole. And your lamina right here, there's like a little pathway. And that's where your spinal nerves go down. So laminectomy, sometimes you get an impinged spinal nerve, right? Either from a slipped disc or other damage. And laminectomy, we cut that part out so that the spinal nerve can be free of any obstruction. And then it should reduce the pain, reduce the swelling, reduce a whole bunch of stuff. But again, you're messing with something, your spinal column, which is supposed to be your semi-sterile. So there's a lot of danger in those kinds of surgeries. Orthopedics, we already talked about. Myelo means bone marrow or spinal cord, depending on what you're talking about. So if I'm talking about myelitis, I could either be talking about inflammation or infection of my bone marrow or inflammation and infection of my spinal cord. Hey, doesn't this look like a beautiful both A and B question? Hint, hint. All right. Clast, break, osteoclast. Now, there's osteocytes and there's osteoclast. Remember I mentioned a couple of minutes ago that your bone is always remodeling self? Well, the way you can get away with, like, falling out of a window or, wait, maybe that's maybe a little too extreme. When you're younger, you could take a hit. I used to skateboard, snowboard, surf. Man, uh, I'm lucky I have all my bones in one tack. But why? Why was it really hard for me to break bones even though I broke a couple? Because when you're young, your osteocyte makes mature bone. Your osteoclast breaks down aging or damaged mature bone. Now, when you're young, this cycle of osteoclast and osteocyte, or what they call remodeling, is very efficient. But then you get a little bit older, closer to my age, it is ill efficient. And I always tell the story of one day I fell out of my car. I just slipped and I fell out of my car. I honestly thought I broke my back. I just fell from my car to the floor of the driveway, and I kind of twisted funny, and it really felt wrong, and my butt and my right foot was tingling, and I thought, no, this is really bad news. It was nothing. I had a couple of bruises, but it's because why? These two cells aren't as efficient as they were when I was 18 versus 50 something or other. Arthrodesis, binding or fixation. Sometimes we got to put pins and needles right through your bones and screws. And that's what arthrodesis is. It's a fixation or surgical immobilization of a joint. It's not casting, it's surgical. That means they got to put metal wires right through the bone to make sure that it grows in the proper order. I've had that done a couple of times in my hand and my wrist. It is not fun. Osteomalacia, that's abnormal softening of the bone. That's not good. That's when you have vitamin D deficiency or something, right? Diaphysis, that's the shaft or the long part of your bone. Dia means complete or thorough, right? I'm using the old definition of dia from this textbook. Through or across, that means inter, in my opinion. But dia, thorough, complete, thorough. And your diaphysis is the middle section of your long bone, the long shaft section. And then the two ends of the bones are called epiphyses or epiphysis. Osteoporosis, ladies, make sure to get your calcium in, because ladies have the ability to make babies. And in order to make babies, you have to, your body has to have the capability of extracting calcium and magnesium salts to make milk out of your bone. Now, here's the bad news, ladies. Even after you're a child or after you're of childbearing age, even if you don't have children, um, your bones start leaking out calcium deposits. So we're always for our older female patients, we're always looking out for any decreases in bone density. And guess what you can do other than, drinking a ton of milk and eating a ton of cheese? Regular exercise. Because if you don't use it, you lose it. Oh, here's a beautiful picture of the diaphysis here. Dia, complete or thorough, right? Your epiphysis, right here and here. right? And you have here a little cartilage right here, that's articular cartilage. And as you could see, bone comes in layers, and there's like scaffolding inside. There's a lot of spaces for arteries and veins. That's a beautiful picture for your anatomy and physiology class. I have pretty pictures too for that class as well. Osteomyelitis, right? Bone marrow, the marrow inside gets infected. Itis, inflammation or infection of. Ooh, look at here, arthroscopy. I love looking at it, but I hate when it's done to me. Arthroscopy, we drill 3 holes in you. One, to either fill up this whole entire area with either fluid or air. And then we can have a trimming instrument or a cutting instrument, even a suture instrument. And then, of course, you have the viewing scope. And all of this can be done. You can even be watching it. And then they have a lovely video which they can email to your specialist. Well, other than the specialist here, if you need a second opinion. It's really neat stuff. Here you go, THR, total hip replacement. And you can see what they did here with the damaged epiphysis. They replaced it with nice metal parts. And come on, there's got to be some more words. Oh, the different kinds of fractures. Well, we're not really going to go to different kinds of fractures. That's anatomy and physiology, but just know there's different kinds of fractures. Open versus closed. Open is when, you know, the bone's like sticking out of your arm or sticking out of your skin. Closed is the preferred one where, you know, we have less chance for infection. Here's the normal curvature of the spine. And remember, if you're looking at your patient laterally, there should be a normal curvature. But if you're looking at them like PA view or posterior or anterior, the spine should be straight. So spinal cord up here near your neck, that's cervical. Your chest or your thorax, thoracic. Here is your lumbar near your loin or your waist. And down here is your sacral, and this is your sacrum, your 4 to 6 fused bones, making your sacrum down here. And last but not least, your coccyx, which is your tailbone. Now let's look at some. Now when you looked at it, the cervical is numbered 1 through 7. So C1 would be cervical 1, C2 would be cervical 2, and so on and so forth. Your thoracic numbered 1 through 12, your lumbar 1 through 5, and your sacral 1 through 5. So those could either be nerves or exact bones, because there's also spinal nerves that are called the same thing. Okay, CT we already went over, carpal tunnel, but I've never seen it called CTS. Maybe these orthopedics dudes call them CTS. Fracture is written like capital F with little X. APPA, you already know that. RA, rheumatoid arthritis. MG, myasthenia gravis, and not really. Herniated nucleus pulposus, we don't call it HNP. Everyone just says it's a slip disc. And a slip disc is a herniation. Remember, herniation means that something that's sticking out that shouldn't be sticking out. So let's look at, I think there's one here. Bunion Cyst. Oh, here we go. I knew there was one. So this is your intervertebral disc. Inter, in between, vertebra. So it's in between the different vertebra. So you have the bone here, the body of it, and another one up here. Here's your spinal cord, and here's your spinal nerve, and here's your lamina, and you can see where the spinal nerve goes right through. Now, this is what happens in a nucleus pulposus herniation, also known as a slip disc. The inside, which is like pulpy, right, and soft, the cartilage gives way, right, through poor posture, diet, there's a whole bunch of reasons. When it gives way, it starts slipping, and then it starts impinging on this nerve, the spinal nerve. And one of two things happen. You either have paralysis and or pain states Either way, it's not good. And they'll always describe the pain as like the shooting pain. Here's classic RA called Dupuytren's nodules. It starts getting these things here. It's awful. And again, I'm not that old yet, but I have RA in the beginning stages, and it is not fun, and it's painful, and there's overall weakness, especially if it's in the larger joints. It's just not fun. Talipes, equinovarus, we don't need to know that. That's spondylitis, kyphos. Oh, here, this is what I want to talk about. So if you look at the spine laterally, it's supposed to have a natural curvature. You have your cervical curvature, thoracic, lumbar, and your sacral. See how it naturally curves. But if you look at it from behind, it's supposed to be straight. And if it curves like an S, I always remember scoliosis. If you have humpback, that's kyphosis. And if you have swayback, that's lordosis. And if the patient is a little bit heavier and has a stomach, it's going to pull all these deformities toward the front, and the pain's going to get worse. Bone reabsorption. Oh, here's another acronym that you should know. NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. That means they're not steroids. They're against inflammation. So if you have swelling of your joints, you take an NSAID, what should happen? The swelling should go down. And look at the different kinds of arthritis. Osteo, bursitis, gout. Ugh, bursitis, not fun. There's pockets of fluid inside your joints, and runners get bursitis a lot in the knees. Gout is, why am I going through the different types of arthritis? You don't need to know that yet. But just know that all of them have the same thing. It is the joint space or the space in between two bones gets inflamed or infected. And the inflammation has significant amount of pain, warmth, and loss of range of motion. Loss of ROM. So we got a moment. Let's look at this guy with his hipster hat and hipster glasses. Arthur Hipster Rexon, right? He's our patient. Radiology, Logi, study of what? Radiation. So he probably had a X-ray. So he had an X-ray, AP lat of his lumbar spine. So we looked at the X-ray of the anterior posterior view. So the X-ray went through the front and then to the back. And AP view also of the sacrum. So we see displacement of his lumbar 5, and it's starting to push on his sacral 1. So there's an L5S1, IV disc space, and it has shadowing and decreased density. That's not good because your bone should be dense, right? When it starts softening up, that means we're going to start seeing some cartilage. We see cartilage, that means potential slip disc or herniation of the disc. There's now slight shadowing of the L3, L4, and L4, L5. So now it's affecting other lumbar in the area. He's status post bilateral laminectomy. That means we already took out lamina in his spinal cord, and we did it both sides, both left and right sides of his spinal cord. That has been done, and is done at the level of L5S1. So there's now hypertrophic lipping, hyper meaning too much, troph meaning growth. So when something overgrows, it's going to lip over that lumbar vertebrae. And now we're going to say slight lipping of the upper margin of the body of his fourth lumbar. Sacroiliac joint spaces were well preserved. That means his sacrum and his ilium, right, of his hips, they're okay. Lateral views of the lumbosacral spine, taking with the spine in flexion and extension, show slight motion of all the lumbar and lumbosacral levels. So he still has some mobility. In real life, we'd have ROM measurements as well from either his rheumatologist and or the orthopedist. So impressions, the diagnosis, degenerative IV disc disease at L5S1. Now he has narrowing of L3, L4, and L4, L5. Slight motion in all lumbar and lumbosacral levels. So we're now seeing movement of his IV discs because it's all like one big sandwich. You know how you move one piece of the sandwich and then the bun gets all screwed up? You know, especially if you're eating one of these lovely, lovely, you know, double whoppers with cheese, whatever you kids eat. What do I mean, kids? I still eat it. So, again, with your textbook, you see that it's giving you, you know, the really nice words. What is nice to look at, and then on top of that, it gives you sample questions. So, do you think I could do? What does the radiograph show? What does the radiograph show at L5S1? Increased density, decreased density? You know, A, B, both, neither. Because what was the cause of his IV disc disease? And then we could look at that. He goes, what else could I ask? Let's look at it directly. I could ask them which views were ordered, because that's one of my pet peeves. How many times I order things and they don't come back the way I want it, or the views aren't the way I want it. I could ask about that. I could ask about what was his past medical history, and you'll tell me he had a bilateral laminectomy. What was his diagnosis? And remember, diagnoses are they're listed by priority. So the degenerative IV disc disease, that's a priority. The motion of his lumbar and lumbosacral levels, that's a secondary thing. I'm way more concerned of number one than number two, and that's actually how we do in medicine. We look at the diagnoses as the most pertinent thing first, and then and then we deal with each problem from top to bottom. So I think you guys can get away with looking at this other one, which is a small case of Mr. Chen Zhang, right? And then I could ask the same thing. And if you look at it, let's look at this word anesthesia before we go. So anesthesia, that's a state or condition of no feeling. So aesthesia is feeling. So, you know, when you get pins and needles, or you can get hyperesthesia, you're feeling too much. And then the pins and needles can lead to pain states. But anesthesia is a state or condition of no feeling. Now, we could give you anesthesia, or my patient could be experiencing anesthesia. Okay? Like, I can't feel anything in my left foot. So when I address the patient, I talk about, tell me about the lack of feeling in your left foot. But on my chart, I'm going to write left lower extremity from metacarpal distally, patient experiencing anesthesia, grade 1 through 5 or whatever, and you'll learn that when you get to your med-surg stuff. Alrighty, that is week, what week is this? That's week 7 stuff. So wash, rinse, and repeat. And while I'm here, I might as well put that case. Does anyone have any questions, comments, recipes? If not, thank you very much.
I want a clarification.
Sure, shoot.
I just want to ask, like, since you said we'll do cases in the final exam, does it mean like we'll start doing from this case 7 that you started teaching today, or we have to do the past?
Nope. Based on the week 5 lecture, any case that's in your textbook from any chapter that we went over is fair game. And I gave an example of, I think, respiratory or something like that. But during these weeks, well, you know what I'm going to do in week 9? I'm going to give you a sample exam of what these cases look like. And actually, I think I have a list of all the cases somewhere. And if I have that, I'll put that down so you can see all the cases. So what should you do now? You should start looking at all the chapters that we did before. At the end of each chapter, there is at least 1 or 2 of those little blue boxes that are cases. So look at that and ask yourself, how could he make a question out of it? And that's exactly what musculoskeletal case. That's exactly what your discussion is for this week. Skeletal. So it'd be choose a case from your module 7 musculoskeletal chapter. If I can spell. And create a quiz of 5 multiple choice items. It's very straightforward, very easy, but it'll help you. This is how you really should be studying. You should ask yourself, what's important, or what does my professor deem important, and how can my professor ask that question? And I've already gave you guys some samples. And if you want some more samples, just shoot me an email, and I got old quizzes, old exams for days. Alrighty, if that's it, everyone have a good night. Try to stay dry. Heaven knows I didn't. So have a good one, everybody.
Thank you.
Thank you. You too.